Hello, I'm Zachary Mead, and today I'll be presenting on the association of multi-generational family history of depression with lifetime depression and other psychiatric disorders in children. This was an ABC study. So a little bit into this, the purpose of this study was to find if having multiple prior generations that were affected by depression increased a risk of psychopathology in children as well as their increased risk of depression. The study focused on families history methods across 3 generations and examined um, associated with an increase of psychiatric risk in offspring. This is the first one to go back 3 generations. Um, this was also done with an analysis of adolescent brain cognitive development study, which included 11,200 children that were part of 9,462 families. It enabled selection of homogeneous samples for genetic and biological studies, and it aided in future mental health screening tools applied to the mental health setting. Unlike other studies, like I said, this one goes back 3 generations, which really does allow for rigorous methodology. This would also kind of lead into the fact that prior studies were limited as to size and data collection. Existing studies are limited to sample size. Consequently, going back 3 generations of family risk established in families studied can be critical neuropsychiatric tool if similar transmission patterns are reliably demonstrated with a family health method. This is also important to recognize the fact that medical records are starting to go back more and more. So the ability to diagnose and look at studies going back 3 generations will become more and more common. So a little bit into the methodology and data. The Adolescent Brain Cognitive Development Study, or this ABC study, provided a retrospective cross-sectional reports of psychiatric functioning among these families, where parents reported on their parents, grandparents, and children reported for themselves, if not their parents reported for them. And all their histories were analyzed. Data was collected between September 2016 to November 2018, and they were analyzed in 2020. The data was measured in 4 categories. These categories look at many different prior generations. The breakdown is G1 or G2, only G1, only G2, or both G1 and G2. So this goes back to their grandparents and stuff like that. Of this study, 47.8% were female, and the average age was 9.9 years old. So a lot of data in this study shows significance. It was found that G1 and G2 for psychiatric illness were positive. So both parents, children were 6.0 more likely to have a psychiatric illness, and in the same group, if 2.1 were more or less likely compared to children with negative G1 and G2. Similar patterns were also observed across other disorders for both parents and children. Reports across sex, socioeconomic status, and race ethnicity. So this means there was really no outlying factor that was seen in the study. Having multiple prior affected generations associated with increased risk of childhood psychopathology was proven to be with depression. Of these detected at pre-pubertal ages existed in diverse racial and ethnic socioeconomic groups. So most of the people recognized symptoms at a young age before puberty had taken place. For now and in the future, this is a big deal and an important study because family history in pediatric settings and in clinical applications for this data can be used in lots of different settings, from biological research to your clinician's office. And of the biological research, some groups are using MRI and genetic analysis to further look into how affected by mental illness as it relates to their parents and their family histories. This is my reference. Thank you very much for listening.